All right, let's talk about some of the barbell movements overhead during pregnancy. There's a couple of different considerations that we are going to have for any overhead movements, and they relate to some of the changes that happen in a woman's body as she progresses through her pregnancy. One of the biggest ones is this added extension through our back. So we have a bit of what's called an exaggerated lumbar lordosis. Essentially, we compensate for our center of mass changing as the baby tries to throw us off balance during our pregnancy, and we extend through our back to kind of keep us upright and keep us balanced. What that's going to mean is it's going to potentially change some of our overhead mechanics, which we want to be very conscientious of. Sometimes other things that we need to consider is any doming or coning across our linea alba. During pregnancy, diastasis recti, or a widening of the linea alba, is 100% normal and occurs in 100% of pregnancies. It's the amazing physiological changes that occur in a woman's body that allows her to grow as her baby grows. What that does mean though is that there's a little bit of relative weakness across the anterior core wall that we need to consider. And if we are experiencing any of that doming or coning, it is usually indicative of a loss of pressure, or that we have too much pressure built up in our core than what our body is currently ready for. If you're seeing any of those issues, and we'll talk about that a lot in many movement variations in our videos and exercise library, that's kind of a step to say, my body might not be ready for that right now. Let's try a different modification or scale. When we're thinking about Olympic lifting, we are thinking about the split jerk and the push jerk. The split jerk is when your feet go front to back to drop underneath the bar to drive the barbell overhead. The push jerk is where your feet go a little bit wider from a power position to a squat position in order for us to drop underneath the bar. Again, our balance is going to be a little bit thrown off as we get through further into our pregnancy. And so our balance on the catch may also be a bit thrown off, especially as we try to manipulate some things like breath. So trying to bring the load down as we're continuing to do these movements and manage some of our breath to minimize impact on the pelvic floor are going to be very important. Many women in the second trimester and into the third just don't feel comfortable doing split jerks or push jerks anymore, and that's totally fine. That change of impact, that sudden movement, can just feel uncomfortable on the pelvic floor. If you're experiencing any pelvic girdle pain or pubic symphysis pain, that can be made a little bit worse by the catch underneath the bar with that load. And so we have different variations to go through in terms of still being able to do that ballistic or power movement driving under the bar. But then also, if that ballistic movement is no longer reasonable for where you're at in your pregnancy, we have different variations that don't have that same amount of impact that can still strengthen those overhead movements so you can get back to a lot of those activities a little bit earlier postpartum. Ways that we can manipulate that is very similar to if you've seen our snatch and clean videos. So instead of moving our feet where that sudden change causes an increase in inner abdominal pressure and impact on the pelvic floor, we can go into no feet variations. This is not going to be possible with a split jerk, obviously, but we can start playing around with the push jerk and do a no foot push jerk variation. So you're still getting some of that power movement that you're so used to in Olympic weightlifting and CrossFit, but you're not having the same impact on the pelvic floor. From there, different variations to still continue using strength are going to be the push press and the strict press. We can even do some behind the neck variations and some variations of strict pressing in different movements like in the split jerk, so that we're still at least trying to work a little bit in that position with balance and core, but we're not putting the same impact down on the pelvic floor. We're gonna go through a whole bunch of those variations, and we're essentially gonna work on those variations in reverse as we continue into your postpartum journey and you recover getting back into these full movements postpartum. So let's go through some of those variations in terms to how we will scale back and modify overhead lifting during your pregnancy. The first thing, just like a lot of our Olympic lifting videos, is that we're gonna start changing our breath strategy. So Brooke is gonna pick up the bar. She's gonna do a split jerk, which is her feet coming front to back, but she's gonna exhale the entire time as the bar goes over her head. Good, come back in. You can do the same thing if you're a person who does push jerks. Breathing out as she goes into that movement. Good. As you start feeling a little bit more impact, or this just doesn't feel super comfortable for you, you can change impact by going to a no feet push jerk variation. So she's gonna bring her feet out to where she would generally catch the push jerk, and she's gonna dip drive underneath without moving her feet. There you go, beautiful, and stand up. This is gonna train that drive, but it's also gonna limit impact. Say these don't feel good anymore. Now we can get rid of the jerk component and go down the list of different overhead series movements. So the first one is going to be a push press. So still getting a bit of that momentum, but instead of having that pounding of jumping from a power position to a squat position, she's gonna just utilize momentum to give her a little bit more leverage. Good. From there, we can get any momentum out of the equation by doing a strict press movement, straight up overhead. Things to consider is the position of your back, because you're gonna wanna arch. Another way that we can reinforce this is to do all of those movements in a split stance. So she's gonna go into her split position, and then from here, you're gonna do a bit of a push press. So bend, press the bar overhead. Good. And then instead of getting the momentum from the push jerk, she can go into a strict press as well. All different ways that we can manipulate variables to allow you to continue doing overhead movements throughout your pregnancy.